Movements of diarthrodial joint. So as we know, the diarthrodial joint are movable joints and they exhibit different types of the movements. First is translation movement or gliding movement. Translation or gliding movement. Here in translation or gliding movement, one bone, it glides over the surface of the another bone. That is known as translation or gliding bone. For example, between the carpals. So they exhibit the translation or gliding movement. Second type of movement, it is known as angular movement. Angular movement. In the angular movement, we have extension and flexion, abduction, and adduction. In extension, the angle between the two bones, it increases. That is known as extension. So suppose if this is a one bone, this is another bone. Here the angle between the two bones, when it increases, that is known as extension. And when the angle between the two bones, it decreases, it is known as flexion. So here now the angle decreases, it is known as flexion. Next is abduction. It is the outward movement. Outward movement of one segment of the body from the central axis. So this is the outward movement from the central axis of one segment from the central axis, that is known as abduction. Adduction, it is inward movement of one segment towards the central axis. So this was all about the angular movement. So angular movements, we have in the angular movement extension, we have flexion, we have abduction or adduction. Extension, when the angle between the two bones increases, it is known as extension. And when angle between the two bones decreases, that's called as flexion. And when there is an outward movement of one segment from the central axis, it is called as abduction, and inward movement of one segment toward the central axis, that is called as adduction. And now we have third movement, that is known as circumduction. In circumduction, what happens? Suppose this is a bone that articulates here with a cavity. So when this distal end of the bone, it will form a circle. So that means the distal end of the bone that will describe a circle, that is known as circumduction. For example, hip joint or shoulder joint, they show this circumduction type of the movement. Now the next movement is known as rotation. In rotation, what happens? Suppose these are the two bones. This is, so here one bone, it will rotate around the longitudinal axis of the another bone. So when they rotate around the longitudinal axis, For example, atlantoaxial articulation, that shows rotation type of the movement. So the movement between the atlas and the axis, that is a rotation. So one bone that rotates around the longitudinal axis of the another bone, that is known as rotation. Now the last one, it is supination and pronation. First, supination. So in supination, when the volar or the posterior surface of the manus that turns upwards or forwards, that type of movement is known as supination. And in case of the pronation, it is opposite. So here in the volar surface or the posterior surface of manus, it is turned downwards or backwards. So this was all about this supination and pronation. So this whole lecture was about the movements of the diarthrodial joint. Thank you.